When you go back to the nutritional studies on diabetes and what gives the body the best chance to reverse insulin resistance, and that's to bring the fat percentage, your dietary fat intake percentage wise, to 10 to 15% the max of your total calorie intake, right? That equates to about 30 grams or less of fat a day. And it's very easy to go over that if you're not careful.
What if I told you that you could feed your dog food that's not only healthier, but also better for the planet? Introducing Earth Animal Wisdom from the Seed Recipe dog food, crafted with care to be healthy for your pet and gentle on the environment. And this complete and balanced formula is carefully air dried at the optimal temperature to preserve vital nutrients your dog needs to thrive, regardless of their age or size, with pure plant nutrition. This is honestly the best vegan dried dog food we have ever tried. It's so easy to purchase too. You're just going to go to earthanimal.com/switch for good. And then also just simply place switch for good in the discount code box at checkout for 20% off your order. So go run, buy your Earth Animal.
Hey, everybody. Welcome to the Switch for Good podcast, Dotsie. It's great to see you again.
You too, my love, and hello to everybody out there. Thanks for tuning in.
Yeah. We have a really interesting guest today that's talking about a subject we've covered before, but we feel like we need to cover it again because so many people are afflicted with this disease and many people who know people who are afflicted with this disease. So, did you know that 500 million people worldwide are grappling with type 2 diabetes? That is what we're going to be talking about today. It's such a staggering statistic. It means that we have a global health crisis on our hands. But we're here to bring you good news. Type 2 diabetes does not have to be a life sentence. Today's guest, Lewis Brutus, is a physician assistant specializing in chronic metabolic conditions. After seeing the toll that diabetes took on both his patients and his wife, he became driven to help others overcome this disease. Holding a master's in physician assistant studies from University of Charleston and a bachelor's in theology, Lewis blends medical expertise with a holistic approach. Through his platform, Diabetes 180, he recommends plant-focused nutrition and lifestyle interventions that empower his patients to reclaim their health. So, in today's episode, we're going to explore his method for treating diabetes. Also, we're going to talk about the power of dietary shifts and why Lewis is so passionate about spreading the plant-based message. If you or someone you know is dealing with diabetes, or if you just want to make sure you're going to stay healthy yourself, this conversation is a must listen. Welcome, Lewis Brutus, to the show.
Thank you for having me.
So I mentioned in the intro that your wife was diabetic. So can we start there and talk about what was going on with her? She was diabetic. She tried all sorts of things. She was even raw vegan. But you helped her change her lifestyle by getting her blood sugar down, mostly by concentrating on one factor. And you got her off medication in 6 weeks after 8 years of her being diabetic. Tell us her story.
You said that you just highlighted the most important parts. So, 8 years of diabetes. She was diagnosed actually a couple of years before I was in PA school. So both of us had to learn diabetes together. It was kind of funny because I'm learning about diabetes in the classroom and I'm going home like, oh my gosh, we got to take this seriously. You're going to die. You're going to go blind. You're going to lose your feet. You're going to lose limbs. Your kidneys going to fail. I'm learning all this horrible stuff because they really zero in on diabetes and medical programs. And I'm learning all this that, my wife has to do, and 8 years later, the medicines that I'm trained are supposed to keep this condition under control are not working. And it was kind of a double whammy because you're a PA and you're as any physician, usually when a patient's health measures aren't improving despite medications, you blame who? The patient. You're not taking the medication or you're not following your dietary advice, right? But I saw my wife, she's taking the medicines, as much as the side effects she could tolerate. She's following the low carb advice, eating healthy, even tried vegetarian diet and nothing was working. So, of course, I realized that, we had to figure out what really works, because the medical model wasn't working. And so it took about.
Lewis, can I just ask you, could you define eating healthy for her then? Because that we're going to really obviously go into food, and that's the hiccup with type 2 diabetes, right? No sugar, low this. And so was eating healthy for her then that wasn't working?
It wasn't working. Yeah, that's a very good point. Very good point. So the first thing she did is follow the advice of low carb, which I believe at the time she was not vegetarian. I think she, occasionally we would probably eat chicken, lean meats. We grew up, we are by faith Seventh-day Adventists, so we don't eat unclean meats, right? So, we would stick with lean meats, and as much as you can, a low carb diet, but her sugars never worked on that. So then we transitioned to reading books like Neil Bernard's books were good. They didn't focus so much on the fat percentage. And at least is one of the books we read. I'm not sure he's written so much, but so we didn't pay attention to the fat percentage while being on a vegetarian diet or vegan diet, which unfortunately, when you do that, you can have a lot of fat even on a plant-based diet, or I should say specifically too much to reverse chronic disease, right? Because everyone's different and everyone's health goals are different. For a person who has diabetes, and we're going to go into it, it's very important to focus on fat, even on a plant-based diet, right? So, of course, we were still cooking with oil. They were still in processed vegetarian meats, the veggie dogs and veggie burgers. I'm sure there was occasional vegan snacks, that wasn't working, right? So being vegan and vegetarian, I know a lot of people say I've changed, it doesn't work, but it wasn't until, like I'm sure you're going to ask, we addressed the real problem, which is the amount of fat in her diet.
And so tell us about, like, she was losing her vision. Her daily sugars were over 400. And tell us about what you did that got her blood sugar down and off medication in just 6 weeks.
Yeah. So it took a lot of research, but I would say 1 to 2 years of reading. And everything I read, it was pretty consistent when you go back to the nutritional studies on diabetes and what gives the body the best chance to reverse insulin resistance. And that's to bring the fat percentage, your dietary fat intake percentage-wise, to 10 to 15%, the max of your total calorie intake, right? That equates to about 30 grams or less of fat a day. And it's very easy to go over that if you're not careful. It is a lot easier to go to be in those parameters as a vegan than when you're eating animal-based foods, because the majority of our foods are fats, especially the harmful saturated fat is coming from animal foods. We got rid of that easily, because she was used to being vegan, but we had to stop cooking with oil. We had to watch how much avocados. She used to, kill some avocados. She couldn't go crazy on those higher fat plant foods. And we used a tracker, a meal logging app, and kept it at 10 to 15%. Within 5-6 weeks, her sugars were normalized, and she no longer needed the medicine that she needed before.
Did you said you did a lot of reading, a year and a half of reading? That's a lot of reading.
Yeah.
We know that the traditional medical model often almost solely focuses on managing diabetes, managing type 2, rather than actually reversing it. So where in that reading journey did you move beyond that mindset where you realized we could potentially reverse this?
It's a good question. I'm glad you asked that, because I feel like I've always felt there was a natural way to heal most of mankind's illnesses. I'm very spiritual, and I feel like, that the way we were created, the remedies for our illnesses is in nature. And so growing up with that mentality, most Seventh-day Adventist Christians are very holistic, and really believe in the vegan, vegetarian lifestyle. So it's easy for us to think that way. So going through the medical training, I still knew that, while there's always a place and time for medicine, that ultimately most of our ills, there's a cure in nature. And in finding a holistic balance, you can cure most ailments. So it wasn't a far stretch to read about it and realize, yeah, diabetes is not an exception.
When you were in PA school, when they talked about diabetes and you were reading about it, were they focusing on the sugar and keeping sugar out of the diet? Because that seems to be the focus. Tell us about that.
Yeah. So yeah, PA school, medical schools, they all focus on unfortunately, the symptoms of diabetes, which is your sugars are high, right? You eat something that has carbs in it and your sugars spike. So it's very similar to how we approach almost all medical conditions, right? If someone has knee pain, we're not worried about the cause. We're just worried about the inflammation, which is a symptom, right? If someone has high blood pressure, we're not worried about what's causing the blood pressure. We're just worried about driving that blood pressure down by any means necessary, right? Cholesterol, we're not worried about what causes high cholesterol. We're going to give you drugs to drive the cholesterol number down. Same thing with diabetes. We're focused on the number, the symptoms, instead of the cause. The cause is not the sugar; that's the symptom.
It sounds like, well, your wife was very compliant, partly because of her faith, right, and her spirituality, which is so strong in our lives. If it's there, right. But in a world where convenience foods that are quite often full of processed sugar and somewhat high fat and very high salt, all of the things that are not good for a diabetes or anyone that, fast-paced lifestyles, people are on the go. They're always grabbing this, grabbing that. What do you have a strategy for helping people adopt and stick to a plant-focused diet? Like if they're really just living on mostly convenience foods, are there like a couple of, I don't know, vegetables that are easy to, take to work with you? I mean, because you can't, we all know you can't, hey, just go whole food plant-based, it'll be good. It's drastic for some people. And I'm curious as to your strategy, especially for our listeners who are going, oh, wow, okay, I think I might want to make a shift.
Sure. And it really depends on the person. Everyone is different in the approach I take. There's almost like two methods to take, the slow and steady or the fast and hard, right? There are some people who can take a challenge. And usually I always encourage them to challenge themselves for 2 weeks. Because if you give yourself a time frame, it's like almost you have an out, right? Like when I'm done, I'm going back to, I'm gonna torture myself. I can sacrifice a few things as long as I can see the light, right? But what's amazing, if a person takes up the challenge, if someone says, you know what, for 2 weeks, I'm going to really go hard on this whole food plant-based diet, the difference between the fast and hard approach versus a slow and steady is that you feel so good. Right? The proof is in the pudding, right? You actually, the weight drops. You see the people lose 5-6 pounds in 2 weeks. Their energy levels are high. They're feeling energetic. Their medicines are dropping. Like it's a lot easier to stick with what works, and that's why I always encourage try it at least a temporary challenge. For those who maybe fail at that, because there's going to be some who try and by just day 3, I can't do this. The slow and steady can work as well. And for the slow and steady, what's going to get you through the slow and steady, because you're not going to get results fast, right? If you're just making maybe starting with changing one meal a day, for example, okay, and not overwhelming yourself, that's okay. But you have to have a strong reason why you're doing it. And I think the why is what gets people through. Usually the people who are most successful in my program, unfortunately, are the sickest. Okay. It's the ones who were told that they're on their way to dialysis, or the ones who are told that their liver, they're now in cirrhosis of the liver, right? It's unfortunately the ones who are told that, they're about to go in for their second foot amputation. So I know it's hard to think that, it's all about the whys, but it really is. Why are you doing this? And you have to have a strong why. And better than thinking about the fear of dying, I always encourage people to think about the joy of living, right? Think about, being there for your kids and your grandkids and your great grandkids, and being able to push them on the swing and walk them up the hill and run down the beach, full of energy and life. I encourage people to have vision boards, to be able to visualize what they want to see in the next 5 to 10 years, to envision health and really see it happen and believe it and feel it. You're more likely to stick with it, and then finally, one thing I always encourage to help get through because no matter how good your vision is, you're going to have struggles in the moment. And that's why I teach people mindfulness meditation. That's huge. And we could do a whole live on that, like a whole video on that. Yeah. But being able to center yourself in the now and embrace your feeling instead of fighting it, allowing your body to embrace your emotions, and knowing that the craving that you feel right now, it's going to pass. It's going to pass. You did not learn to crave sugar overnight. Okay. We didn't come out of the womb looking for a lollipop, right? We learn these cravings and we can unlearn them, right? We just take patience, commitment, and a strong reason why.
So much more than just the food.
Yes, yeah. It has to be more than just the food.
Are you wanting to lose body fat, build lean muscle, and strengthen your bones? Do you want to once and for all stop feeling uncomfortable in your body and start feeling good about how you take care of yourself? Well, I have 3 words for you. Fit Vegan Coaching. And for me, this is personal because about 6 months ago, I was in a real rut. I was eating unhealthily and I was waking up not feeling good. So I reached out to Maxim Sagoin, who'd been a terrific guest on this podcast and who is the founder of Fit Vegan Coaching. And I asked for help. Maxim and his team were so kind and non-judgmental. So for the first time in my life, I signed up to follow a program, and it was like a miracle. Through his coaching sessions, webinars, training app, food guides, and the support of others in the program, I transformed the way I was eating and training. And now at 61 years old, just 6 months in, I feel amazing physically and emotionally. And I think I look pretty great too. Fit Vegan Coaching is the world's top whole food, plant-based body recomposition coaching program with over 800 transformations in more than 20 countries. It's definitely one of the best investments I've ever made in myself. So if you are feeling anything like the way I was feeling 6 months ago, or maybe you just simply want more information, go to fitvegancoaching.com to book your free application call. And if you sign up, you'll get $150 off because you heard it here on Switch for Good. Now, back to the show. Yeah. I remember somebody told me, Alexandra, being hungry is not an emergency. Because I think we in America, we treat it like that. I'm guilty of that. It's like, I'm hungry. I need it now. I might die if I don't have it now. It's such a superficial way of thinking when there are people who truly are starving, and we have a real misconstrued idea of the food that we need.
That's so interesting that you bring that up, because Alexandra, you know how I have always been like, I'm not intermittent fasting. Like I'm not trying it. I had an eating disorder 80 years ago. It's a very long time ago, but it could get me, could come back. And I haven't been specifically intermittent fasting. Like I'm not counting the hours or anything, but I have been waiting in the morning, and sometimes it's 10, 11 or noon before I even have any hunger pains. And then I've been sitting with, right, to Lewis's point, that feeling of hunger and feeling hungry. And I had done so much hard work healing from my eating disorder that there's not a second that is coming back in. I'm having a completely and totally new experience with just experiencing that and stopping saying, oh my God, I'm starving. It's like, no, you're not. Since then, I have never been starving. So, I feel the hunger pains. Oh, okay. I don't really need to satiate them right now. And just going through that experience, it feels what it feels like. And it's not an emergency. And I finally do eat, sometimes sooner than later. And then I'll realize like, oh, I actually gave my body like a 16-hour rest from kind of thing. And it's like, oh, okay. For some reason, I don't want to get like militant about like intermittent fasting. I'm going to do it on these hours and everything, but I'm doing it just by proxy, just feeling my feelings and experiencing that what it feels like to be hungry, and then just leaving it alone for a couple hours.
Lewis, you actually prescribe intermittent fasting for your patients. Can you explain to us what are the benefits that you see in that? Because my initial reaction is, oh, well, the blood sugar will go up and down too much. It'll go too low and then when you eat, it'll go too high or something. But you think that it's a very good practice for people who want to maintain a healthy blood sugar.
So intermittent fasting is something I definitely prescribe, regardless of, who you are. It's amazing. Even if you are on insulin, you can make it work. But the benefits are huge. I think Dietary mentioned one of the biggest parts is having control over your cravings is definitely one of the hidden benefits of that. Being able to train yourself to say, you know what, I can say no to food for a moment of time. I can get through hunger, right? Intermittent fasting, I usually encourage people to do the 16 to 8 at least. That's where you see most of the benefits. Comes to, weight loss for sure. When it comes to making your body sensitive to insulin, autophagy, that's a process of your body, your cells recycling and cleaning up the debris, reducing inflammation, so many benefits from intermittent fasting. I usually encourage people to start slow because it is hard if you've never done it. The hours that are easiest for most people I've worked with are 12 to 8 is their eating window. It's easy to remember 12 to 8 for one. Your memory gets foggy when you're hungry. So 12 to 8 is an easy thing to remember. But however you can make it work. So that's, it's something I always have my clients do.
When you said sensitive to insulin, can you explain to our audience why that's important, what that means?
Yeah, that definitely gets into the biochemistry of what diabetes really is. So diabetes essentially is the disease where your body is, type 2 diabetes, I should say, is a disease where your body is no longer sensitive to its own insulin. Right? So your pancreas is now in overdrive, overproducing insulin. And this is why the disease gets worse, because the pancreas gets stressed and trying to overcome this resistance and eventually shuts down. Okay. Type 1 diabetics is different, but they can also suffer from insulin resistance. With a type 1 diabetic, their pancreas is no longer producing a sufficient amount of insulin, but even the insulin they inject can get to the point where your body is rejecting it, right? Because the diet you're eating, the lifestyle and the diet is basically promoting resistance to the insulin. So you need more and more of it to drive the sugar into the cells where they belong. So when you go on the right lifestyle, low-fat, whole food, plant-based, intermittent fasting, exercising is a good thing. I encourage people to build their lean muscle, see it as cabinet storage for sugar. You're getting your body sensitive to insulin again. So it takes less insulin to do its job, whether you're injecting it as a type 1 diabetic or your body's producing it. And that's what really leads you to reverse the disease. Because guess what? Now you could eat carbs, a bowl of fruit for breakfast, and your body just responds like it normally should.
And this is because the cells are not full of fat, which are stopping the insulin from getting in. Is that correct? And that's why it's so important to have a low-fat diet?
So that's it. Certain tissues specifically, being the muscle and the liver tissues, where they're designed to use glucose for energy and store small amounts of fat. But unfortunately, in our diets today, most of our diets contain as high as 40 to 60% fat. And all that gets stuffed in storage places. Our body's not designed to stuff the fat. And eventually, it leads to almost a backup system where the body's like, you know what? Insulin, you got to slow down because we have enough food energy in the form of fat in these tissues. And it starts ignoring insulin.
I'm thinking about the connection between saturated fat and diabetes. And I'm thinking about bulletproof coffee and when that craze came out, and, it's like starting your morning with a coffee with a dollop of butter. And then all the vegans are like, oh, dollop of coconut oil in the, that'll, and I was like, I don't think that's what we're supposed to be doing. I want to talk a little bit about, is the saturated fat in coconut the same as the saturated fat found in animal products like, eggs, cheese, the stuff from a cow?
Yeah, the animal products is definitely higher in saturated fat, right? So the plant fats like coconut or olive oil, they're going to have some amounts, but it's mostly monounsaturated, which is a healthier fat. So if you're going to do anything at all, maybe in moderation using a coconut oil or even olive oil in moderation. But animal fats by far are worse. They're definitely worse because they have a lot more saturated fat in them.
So if somebody's going to use coconut oil in cooking, or they're going to do bulletproof coffee with coconut oil or something, is there a percentage per day where you're like, do not go over that 10%, 15% fat, or saturated fat is really what we're talking about? Yeah.
Great question. So I get this question a lot, when it comes to coconut oil or extra virgin olive oil. Should I use it? I think there's a big debate in the whole food plant-based world whether or not we should be using oil at all. Some people call it the sugar of the plant fat world. Some people say it's healthy, and they highlight all the benefits from it. My take is a little different. If you are healthy, okay, you have no high blood pressure, no high cholesterol, your blood sugars are normal, and you want to use a little bit of coconut oil, that's fine, right? But if you find that you're on medication and you're trying to reverse chronic disease, that's the first thing I'm going to say get rid of, right? Because it might be causing a problem, right? So if for a healthy individual who I encourage who's eating a whole food plant-based diet, I'm not going to pick on the oil so much, but for clients who are actually, struggling with chronic conditions, then it makes sense to get rid of oil, to go no oil. Then that's basically my take, yeah.
Did you know that as we age, our bodies produce less collagen? This vital protein that keeps our skin firm and supports muscles and joints starts to dwindle, leaving us with a few more laugh lines and a bit less bounce in our step. But there's good news. Yes. With Vedge Vegan Collagen, you can naturally replenish this essential building block and get your glow back. Through innovative extraction techniques from nutrient-rich broccoli and carrots, they've crafted 100% plant-based collagen that effectively reduces the signs of aging. It supports skin hydration, enhances joint flexibility, and strengthens hair and nails, so you can look and feel fabulous. And the best part, there are no chemicals, no preservatives, and absolutely no animal products, just pure plant-based goodness. So stay youthful, stay active, and choose Vedge Collagen. Elevate your daily routine and let nature help you shine from the inside out. You're just going to go to vedgenutrition.com. That is VEDGE nutrition.com and use code S, 4G for 30% off. Right? You got it. One more time, vedgenutrition.com and use code S4G for 30% off your order. Now back to the episode. Yeah, I'm not a medical professional, so I don't really say anything to people, but I always think of when people are talking to, they're non-disease people, in fact, really healthy, fit, clean artery people that are vegans are like, absolutely not one single ounce of saturated fat. And all of the studies that, we lean on to say no saturated fat are most of them from Caldwell Esselstyn, right? And all of those studies were on diseased people. He was reversing heart disease in diseased people. So it's, so to your point, and I'm always like, I don't know if we have any studies of really healthy, blown out clear artery people that are a healthy weight and that then, could, exacerbate heart disease by eating 10% coconut oil fat a day or something like that.
And of course, there's population studies that you could look at in the endpoints and seeing if heart disease rates go up for those who use oil or don't. But when it comes down to and on an individual level, the problem is that we all metabolize a little different. Some people store fat quicker than others. And so some people, that's why you have some people who can eat like, anything, and they get perfect lab work, and like, and then you got another one who eats oil and their cholesterol spikes, so everyone is different, right? So, but I think it's a really simple approach to eat as healthy as you can, right? Treat yourself with grace, don't allow, stress food or your food choices to become stressful, because stress kills too, but do the best that you can with the knowledge you have.
Speaking of fat, I eat a lot of fat in my diet because I eat a lot of nuts. And when I feel not satiated, I always go for my unsalted, crunchy, natural peanut butter. And I stick my spoon in there and I eat it and I get full after probably like 4 tablespoons, which is a lot of fat, right? So I feel like that fat is satiating. What do you say to people do you have clients who struggle with lowering their fat because they just don't feel full? And what do you tell them?
So it's really simple, because the thing is, when you're going low fat, whole food plant based, you're eating a lot of fiber, right? And fiber is low calories, right? Fiber is essentially 0 calories, because it actually even pulls some of the food, the caloric count content, through the stool. So the problem is most people don't realize they're not eating enough food, right? They're using the same portion sizes but you can't do that. You gotta fill the plate. Okay. You gotta take your time and eat till you're absolutely satiated, that you're actually satisfied. If you're hungry, go get more. Okay. The food, it's almost a stretch effect, right? Your stomach's going to tell you when to stop, and you're going to have that signal going to your brain. And, but you have to eat more. And what's lovely about this diet is that you could eat more and you'll still see the weight loss and the blood sugars improving and all other health parameters while eating more. It's the only diet that you could eat more and way less.
And it's true that we had Chef AJ on, and she talked about potatoes being the most satiating food. And I had always thought it was fats. She said calorie per calorie is the most satiating food, but there are things in the low fat, plant-based whole food diet, like yams and potatoes that can be really filling.
Yeah, and that's the thing, because what you need to consider is that, the not just how much it makes you feel, but does it fill up your calorie meter first, right? So the fatty foods are higher in calories. Fat has 9 calories, right, per gram, versus carbs being 4. So yeah, you're gonna get, let's say if you need 1,500 calories in that as maintenance, it's a lot easier to get to the 1,500 a lot faster with high fat foods, right? Versus with low fat foods, carb centered, you're actually gonna struggle to get past 1,500. Trust me, you're gonna struggle, right? And it's gonna be amazing. What's amazing is that you find yourself, everyone who adopts this diet fully finds themselves eating more than they did before, without being hungry. That's when you're not hungry. You have more food options even.
I used to do exactly what you're talking about, Alexandra, whether it was almond butter or peanut butter or just nuts, just handfuls of cashews or whatever. And then we live in Mexico part-time, and my husband started homemaking Mexican beans with, simmering them all day with the onions and the garlic and the veggie broth, and they're so good. And so we had a lot of them around, and then he was doing with all sorts of beans. And I think one of the easiest beans to just move on through are lentils, right? Like there's just I have no gut bloat. I don't have it with the other beans anymore, but people do. So I always say, do lentils, start with lentils, don't start with the kidney beans. And so I've been doing that, I don't know, probably for like a year. If I just can't feel satiated and I feel hungry, he's got them in the refrigerator in the big Tupperwares, and I will just eat them until I am just totally and completely satiated. Sometimes it's quite a lot. And I'm like, and so I've learned, I think it's the fiber then that's actually making me feel satiated more than the fat. And this is just an N of 1. But what do you think?
That's the science behind it, is the fiber. And that's why you're encouraged to not just graze, but sit down, plan your meals, right? Make sure you have time to fill up the fuel tank, and enjoy. And there's so many other benefits of that, of not just kind of snacking through the day, but sitting down and having planned meals. Yes, legumes, huge, whole grains, starchy vegetables. Those are the things that are going to fill you up. Okay. And then you got fruits and a nice green smoothie you could drink for a snack all day or all day. So, but having a diet that's centered in whole grains, legumes, and starchy vegetables, you're sure to be satisfied. And the satisfaction does last. Actually, studies show the high fat foods in comparison, yeah, you might feel full, but it doesn't last. It doesn't last. Especially animal fats. There's even studies that show that, there's how it affects the hippocampus and memory. Like you may forget you ate if you have a standard American diet. It's so toxic to the hippocampus that you forget you ate. Yeah, it's the lipotoxicity, really in the brain can even lead to short-term memory loss, and that's why we know animal fats actually can are one of the indicators of dementia, and cognitive decline.
Wow. That's a mind blower.
Your wife actually, on your website, lewisbrutus.com, you have interviews with some of your clients, and your wife being one of them. You have a lovely interview with her. And she talked about the keto diet. She said her blood sugar did come down, but it wasn't sustainable. Now, keto diet is a high fat diet. So explain a little bit about how her blood sugar came down on keto, but why you don't recommend it.
And even vegan keto is too, right, Alexandra? I'm saying that because like our listeners.
So, if we're talking about animal-based keto, there's too many risks, right? We know that one of the leading cause of the world's, I was going to say America, but the world's number one killer, right, is heart disease. And when you're eating a diet that's centered in animal foods, high in animal protein and high in animal fat, you are setting yourself up for the leading cause of death. So that's enough for me, right? Having a diet, many nutritional studies and population studies have shown the more animal protein or animal fat, the more risk of heart disease, as well as other factors like stroke, dementia, cancer. So we knew this. We knew that this was just temporary because nothing was working. It was a last-ditch effort. Why, of course, it works is because it makes sense. If the symptom is sugars getting trapped in the blood, you get rid of the sugar, but you don't get rid of the disease. Because if you think about it, like if someone goes on a keto diet, yeah, their sugars are now normalized, right? They prick their finger and they got a perfect number, but give them a glucose challenge test, right? That's how we diagnose some diabetes. They take a sugary syrup drink and the sugars go crazy. They go up, right? Or not even that, start eating a banana, right? Eating some fruits. Right. And now your sugars are crazy. So did you really reverse the disease? Or you're just masking the symptom, right? That's all you're doing while unfortunately exposing yourself to other harm. Right.
And it's hard, as she said, to keep up. She missed a lot of foods being on that kind of very restrictive diet. People think veganism is restricted, but as you said, it's actually you eat a wider variety. You have such a variety.
Yeah, it's less restricting. So, obviously there's a challenge when you're used to the standard American diet, because there's a lot of foods you have to unlearn, I guess, cravings you got that have to change. But yeah, you'll be amazed if when one person, I've never had a person who fully embraced the whole food plant-based lifestyle, not be surprised by the choices and the variety that's included. It's very inclusive. There's so many things to eat.
I've never known anybody that has stuck to keto, vegan or animal-based keto. Is there, I mean, it seems like more of a jump start to weight loss. Would vegan keto be a good jump start, or would you still say, nah, don't mess around, like let's just go straight into the whole food plant-based?
The reason why I would say I wouldn't recommend it is because you can get the same benefit with the diet that reverses the disease. So that's why I teach that method. I do understand that, a lot of people want results, so that you can get quick weight loss with keto, vegan keto, or even animal-based keto. So if people are doing it for that because they want to see the scale start moving quick, I can understand that. But I always caution people that it's not necessary. You're going to, if you truly adopt a low fat, again, between 10 to 15%, and making sure you're sticking with complex carbs, right? You're going to lose weight and you're going to be able to give yourself the best chance to come off medications.
Can you give us on your website, you have this, but some success stories with people with whom you've worked?
Yeah, I love success stories. So one of my favorites is seeing someone who was on the way to dialysis. I mentioned this. Doctor said you're on your way to dialysis. In 3 months we're gonna recheck your kidney levels, and we'll start scheduling your appointment, because the thought is once you get to a certain level of kidney failure, there is no going back, right? So it is scary. So she reached out to me. We worked for 3 months. She went back to her kidney doctor, and her doctor said, "What did you do? Because your kidney numbers went up. I can't start you on dialysis." And it's almost like they were disappointed because they lost a customer. And she was telling me they were making a big deal. They called the other doctor in the room to look at her lab work and wondering, was there a mistake, an error? No, she just ate the way she was, we were designed to eat. And the body healed itself. And that's what happens so often. The biggest 90 days, the biggest change was this, still boggles my mind today, was someone who had an A1C of 15, okay, and in 90 days went down to 5.3.
Wow, 15 to 5, because we're supposed to be around under 5.6.
He was a newly diagnosed diabetic, though. He was that. And obviously, the longer you had diabetes, the longer it's going to take to see those numbers improve. But the best chance you have to turn things around is, sooner, right? As soon as you get the diagnosis. Same with pre-diabetes. If you're a person who has pre-diabetes, you should take it serious, because a lot of people say, I'm pre-diabetic, I'm okay. But even as a pre-diabetic, studies are showing you're still suffering from the complications that diabetics have, right? So it needs to be serious at any stage, and the earlier you take it serious, the quicker you're going to get results.
And how is your wife doing?
She's doing great. She's lost, I think at this point, I'm almost going on 70 pounds. Energized, is able to do so much more, and just has a really positive outlook on her life, of not being with a disease that cuts life short so often.
Here's what I want you to tease for us, because to somebody who might be pre-diabetic or is diabetic and headed down the path of potential dialysis and heard what you just said, right? Complete reversal for this person in 90 days. I'm going, okay, what did they have to do their first day? I mean, I'm thinking, oh God, this must have been so intense, so restrictive, so difficult. But yet she was faced with something pretty scary, so she was compliant. And this leads us into your Diabetes 180 coaching program. What did that lady's first week look like?
Okay. Oh, you're saying for my wife, for my wife's first week?
No, the person that came to you they said they were getting ready to schedule her for her or him, I'm not sure, right? Schedule for the dialysis.
We actually had a consultation, I think it was I can't remember, it was earlier in the year. And then she didn't sign up for the program, but she came back after. Like I said, it's not until people get scared. Then she's like, okay, I need a change right now. I'm really scared. So she was already ready mentally, because in the consultation, what I tell people is that everything I'm telling people right now, that it starts with first, if you're going to do anything first, it's getting rid of animal products, right? Which a lot of people are like, whoa, I can't do that. But again, she just changed everything overnight. She's different because she wanted to keep her kidneys, right? So not everyone has motivation. If you don't have that motivation, if you feel like, you don't have that commitment in you, then just start with one meal a day, right? Just start with one meal a day. That's one method. Another method I encourage people to do is start writing down. Just start with writing down every meal you know how to make. Right. And you'll be surprised how it's a lot shorter the list than you think. How frequently people make the same meals. But and then figure out how you can make those meals vegetarian, right? How can you make, instead of making, chili with meat, now you're making 3-bean chili soup, right? Or Billy stew, right? You used to chicken burritos, now you're making vegetarian burritos, right? You're making spaghetti, but you're leaving out the beef, right? So a lot of meals that you're familiar with making and that you don't have to think too much about, you can transition them easily to be vegetarian. Never mind the fact that there's probably a lot of meals you're already eating that are vegetarian, right? A salad is vegetarian, right? Like oatmeal is vegetarian, right? So there's a lot of just getting them to realize that the change is not as drastic as you think, right? You are, closer to a plant-based diet than most people are, than you think. And then from there, every week we work on adding new meals to continue to add that fresh variety and excitement, because food should be something that you look forward to, not dread. And so that's what adding meals regularly is important.
That kind of takes us back to you talking about people's why, right? And what really, and somebody that had such a scare, she was ready to get militant the next morning at 8 a.m. and was not gonna mess around. And then but the recovery, the quick recovery in 90 days is just mind blowing that can happen and exciting for people to hear. But don't get to that point. Do it. Yeah. Wow.
Tell us about some of the foods that you recommend that people seem to really like, who might be standard American diet eaters. For breakfast, lunch, and dinner. You kind of gave us an idea when you talked about veganizing meals, but what are some that are really popular?
And that's a beautiful thing, for regardless of your culture or your background, you could find a meal that you can make plant-based. And even in the list, they even have different cultures: Mexican, Ethiopian, Asian, so you have different, and that's what's nice about being American. America, we're a melting pot of meal. To eat an American meal, means eating Chinese. It means eating Mexican. It means eating, so Italian, right? So we're used to borrowing other cultures for food, and most other cultures are very close to plant-based. Now, if you're talking about the stereotypical American meals, I would say bean-based burgers. I love bean-based burgers. So lentils or black bean burgers, are really good, to transition. Mushrooms is going to be something you're going to be using a lot. If you like that meaty texture, you're trying to replace in meat. So beans and mushrooms are going to be like your meat replacement in most cases. For eggs, you're going to be, people, they cringe when you talk about tofu, but it's because they haven't had it properly seasoned. All right. I like to soak my tofu in soy sauce. Oh man, that will get that salt in there, and fry it, scramble it up like scrambled eggs. So scrambled tofu for, your egg replacement. Let me think. Of course, you could pasta. Any of your grains, I just encourage them to transition to whole grains. So whole grain pasta, whole wheat pasta instead of your traditional pasta, which really tastes essentially the same. You're cooking brown rice instead of your white rice. So, but yeah, that's basically my approach. There's a lot of variety, and people are surprised usually on how easy it is to make the transition.
And what about the oils? What do you use when you're making that black bean burger or that tofu scramble?
Surprise! Water does the trick. It does. When you could steam, you could stir fry, you could cook with vegetable broth. Some people like vegetable broth. I throw soy sauce in the pot too to get even more flavoring. And for it. But what people are surprised, it's the moisture that cooks. Okay. And that's all you need is something moist, and it cooks, and the food has its own flavor. And with time, like I said, what's beautiful is your taste buds change, and you start, like, I guess my wife and I, and a lot of people who have done this a long time, they get to the point where they can taste the oil in food and it turns them off. Right. So yeah, you just got to give yourself that time. Yeah.
Mm-hmm. Yeah, that's true. Especially if it's like burnt at all.
Yeah.
That's horrible. Yeah. Taste, flavor.
You can undo it. Yeah. Your taste buds change, I think, every 7 days. So just give yourself time. Yeah.
Just a little amount of time.
A little bit of time, man.
Oh,
Where can people find you, Lewis, especially if they're interested in your Diabetes 180 coaching program?
So I guess the best way to find my content, of course, is YouTube. I post videos every week on YouTube. I'm also on Facebook. You could just find me with my name, Lewis Brutus. And I also have a website with the same name, Lewis Brutus. I'm sure they'll see my name in the show notes. And my email is the same, Lewis@Lewis Brutus. I keep it simple.
You're smart.
But the name of the business specifically is Diabetes 180. But you could find me on lewisburtis.com, and I'm on YouTube and Facebook.
And you're very generous with your information. So I really recommend people go to all those platforms to learn more. And you can book a free consultation with you, right?
Absolutely. Yep.
Okay. That's very cool. You're so good. Like you just nailed them. Like,
I'm excited. It's my passion. Thank God.
Yeah, but you're an awesome interview. There's so much packed into just, I don't know, 50 minutes of something that people are going to just love and dive into and learn so much from and change from. Yeah, really cool. All right, my friend.
Thank you.